Let's get a good thumbnail. So, like this. All right, that's good. That'll be my thumbnail. I want to welcome everybody to our discussion today. I've got my brother, Dr. Baird. He's an emergency physician, and he's got a wealth of knowledge about the COVID-19 situation and kind of how the front lines are dealing with it. So I'm going to turn it over to him to talk about a medical update and where we are. So where are we?
So let me just start with a disclaimer. This is not to be misconstrued as medical advice. What we're doing today is discussing our own opinions about the financial world, the economy, and the medical world in relation to COVID-19. If you have any questions about guidelines or official recommendations, you should go to the Arkansas Department of Health website or the CDC website to get further information or guideline recommendations for that. Don't depend on anything that we discuss today to make your decisions. We're just basically giving our opinions about what we think. So it looks like we should be cautiously optimistic about where we are. According to the latest numbers, we've gone up about 22,000 so far today. We're just over 400,000 as of yesterday, and so it seems to be at least the rate of growth is kind of slowing down. It doesn't have that exponential growth that we were seeing where things were doubling every 2 or 3 days.
Right.
It appears like New York, which has been the epicenter here, is starting to level off. They've kind of started to see about the same number of new cases over the last few days, which is not definitive, but that's a really good indicator that it's not doubling and doubling and doubling so much. Right. We had almost 2,000 deaths yesterday. Mm-hmm. And so we're hoping that we're getting close to the peak across the country as well. Of course, there's going to be different peaks in different areas. Arkansas, the latest projections that I saw was that we were going to probably peak in another 2 weeks or so, which is probably about right. And the projections for the number of new cases and the number of deaths in Arkansas has been adjusted downward dramatically from the numbers that we were projecting, or that the experts were projecting.
Yeah. And they projected
even just a couple of weeks ago.
3,500 was the number they were thinking we were going to peak out at.
Yeah, so Arkansas has adjusted. We've seen a huge adjustment in the numbers of projected bed needs and ICU bed needs. Over the last week, they've made some huge changes to where they were projecting we would be. And as of now, based on the numbers that we have, so far, it doesn't appear that we're going to have a shortage of ICU beds or anywhere close to a shortage of ventilators in the state of Arkansas. Now, overall, in the United States, they're still projecting that we'll have a shortage of ventilators, but how many is in question, and we're projecting to have a shortage of ICU beds as well, but it's much less of a shortage than what they were projecting before. So hopefully those numbers will continue to go down as we get more information and see what the effects of the social distancing have been. And hopefully we'll not have any shortage, but we won't know until we kind of see. We're going to have to let it play out a little bit longer before we know.
Plus they're surging like in making ventilators, and
yeah,
I mean, like,
so there's a lot of companies that are jumping in trying to. Now, from what I've seen in the reports, there's been some varied success on people being able to deliver, companies being able to deliver the ventilators, but it's definitely in the works. I mean, there's all the incentive in the world for them. I mean, they can print money if they can make ventilators or PPE.
N95 so masks. Yeah.
The market's going to respond, I think.
Yeah,
and fulfill those needs.
And they've expanded ICU capacity significantly, right? I mean,
huge number of new ICU capable beds have been created, field hospitals, and so those are things that they can throw up pretty quick in the epicenters and places where they need it.
Okay, good. Is there any new medical guidance for people? Just from our last video, the last video we made was 3 weeks ago now, something like that.
Seems like forever.
Yeah. So is there any new guidance on what people should be doing?
I wouldn't as far as the recommendations that were in place at that point in time, I don't think that there's been any change in the recommendations. If anything, it's become more of strict recommendations for social gatherings. No more than 10 people in one, or no more than 9 or 10 people. I don't know what the cutoff is. So
10's the cutoff.
10 or less people can get together in Arkansas, and there's some places where they're even more strict with that. I think that's a good idea, to not get together with larger groups of people if at all possible. Maintain 3 to 6 feet of distance between you and other people if at all possible. Wash your hands frequently, and the CDC just recommended last week that it would be reasonable, or they said it would be reasonable for even people in the public to wear a mask whenever they go out. And I think that's probably a good idea. The main thought behind that is that you could be preventing people that are asymptomatic from spreading it to other people,
right,
because they've shown that it could be, or based on some things that they've seen, they believe that it could be spread not just by coughing but by breathing. And so if you're wearing a mask, that might potentially keep you from
infecting
particles that are coming out of your mouth whenever you breathe. Even though you're not coughing, you could be spreading it to people. So I mean, at most hospitals, all the medical staff that works in the ER is wearing a mask of some type. I wear a respirator, P100 respirator, and then if I've got a high risk person, I put on a face shield with another face mask on top of that. I don't. You can't be too careful. I mean, right now, it doesn't appear that it's. I mean, it could be a whole lot worse as far as how contagious it is. It could. I don't think it's as bad as what some thought it was to start with.
The contagious.
How contagious it is,
yeah.
But I mean, it's still somewhere in that 2 to 3 range. The average person that gets it will spread it to 2 to 3 people. The flu is about 1.2 or 1.3, so it's at least twice as contagious as the flu. But
so what you're saying is, if you're not wearing a mask, you just want people to die. Is that what you're saying?
Just want people to die.
You just want people to die, right?
Right. That's what it is. Now, what I would say is, I mean, it looks like things are getting better as far as the supply of PPE. We're starting to see, slow trickle of that stuff coming in. We're supposed to have a shipment coming into our facility very soon, and we're getting some distributed from the state government to the hospitals. We've had a couple of shipments of PPE that we're supposed to be getting distributed among us, all hospitals. But what I wouldn't want to happen is I wouldn't want the general public to go buy up all the PPE and starve the hospitals even more than they already are. Now, I don't know where they would get it, because most places are restricting the sale of it to medical facilities now. So I think if you can get a mask, or even just have a homemade mask and wear it out in public, it's definitely better than nothing. And it
won't hurt, might help.
It might help, right? Might help, won't hurt.
Yeah.
Don't paint yourself green though, because
don't do that. Yeah, don't paint yourself green. All right. Well, what about what about people that think they have it? What should that person do?
So at this point in time, if you get a viral upper respiratory type illness, if you have a cough, you have a sore throat, low-grade fever, body aches, flu-like symptoms or cold symptoms, I would assume that you have it until proven otherwise. Now, what do you do with that information? I don't think that everybody that thinks they have it don't think that everybody that thinks they have it need to be tested necessarily. We just don't have the capability to do it, especially in Arkansas. They're kind of shifting those resources for testing to hot spots and places that have much higher rates. And so the places that really need testing are the ones that are being hit harder than us. And so we just don't have widespread testing available where anybody that wants to be tested can be tested. I think if it's somebody that's feeling short of breath, feeling like they can't breathe, having chest pain, skin or lips turning blue, if somebody's lethargic or confused, signs of low oxygen level, those people, they need to go to the hospital. They need to go to the ER, and will almost certainly be tested for it. If they're being admitted, they're going to be tested for it.
Sure.
But there are a limited number of tests. Now, there are some places that are doing drive-through testing. UAMS is one, and they have in-house testing where they supposedly can test up to 400 patients a day. From what I've heard, they haven't gotten up to that number yet. But those are going to, continue to pop up in different places. Hopefully, over the next couple of weeks before we hit our peak, we'll have our testing availability will increase greatly enough to meet the demand for it, because that's the number one way that we can fight this is to know how widespread is it, how many people are getting it, number of new cases, so that we can kind of know where we are in the fight.
Test, isolate, contact trace, do all those things.
Right, especially in a place like Arkansas where we only have 1,000 cases out of the entire population that we know about. Now it could be orders of magnitude higher than that have been undiagnosed because we haven't tested very much at all.
Yeah. What about the serum test or the antibody test? When are they're online now, or they're about to be? Or?
There are places that are selling those types of tests right now. As far as widespread availability, it's still going to be a long time. There's a global demand for those, so they're going to be made. It's just a matter of who's going to be able to mass produce enough of those and show that they're effective. Because there's places that are selling them, and then you end up finding out they're not effective. They're not sensitive, not specific. They just don't work. And so we have to have a reliable test, and something it can't be super expensive either. I mean, it would be very useful to be able to test take some random sampling of the population to see how many people have actually had this and recovered from it. That would be extremely useful information if we could do a population-based study where we just took random samples of people from different states and saw what's the incidence of people that have antibodies against this. Because if we find out that 30% of people in the United States, I mean, I'm just throwing that number out there, could be much less than that. Even if it's 5% of people or 10% of people, then that means that we are off by a factor of 10. It could be that we are way, way, way under. The denominator is way larger than what we think it is,
and that would make some sense. I mean, it certainly is. The denominator is way bigger.
Almost certainly is way bigger.
But we just don't know if it's an order of magnitude or 10 orders of magnitude higher.
Or 2 or 3 times. I mean, we just don't know. I mean, we don't have any way to necessarily know that. There was a study that they published, I believe it's last week, in the United Kingdom, and they projected that between 30 to 40% of their population had it.
UK? Really?
Yeah. If that's accurate, then that's some really good information to have.
That's hopeful. I mean, that's better, right?
And if we did some type of a population study and found that a significant portion of the population has had this, it would be really useful information. From all aspects, how to prepare for it going forward. How much can we ease up on any of these restrictions that we've put in place? Can we start letting people, get back to their normal lives? If we find out that a whole lot of people have already had it and didn't have symptoms or had mild symptoms, and we just haven't confirmed that yet, then that would be incredibly useful information.
And I mean, we've spent and it's cost us trillions and trillions of dollars, which kind of brings us to the economic question in this whole thing, because at some point, Trump and other people have talked about the cure shouldn't be worse than the disease. And so, I mean, at some point in shutting down the economy, in stopping the economy, it becomes worse than the effects of the virus could be. Even at worst case, the case fatality rate in this is probably no more than 1%, right? I mean, is that around that number? Is that accurate?
Of the numbers that we have in the United States confirmed cases, it was 3.4, 3.5%.
Yeah.
But that's the known confirmed cases.
Right.
Confirmed, there's also a question about, how many deaths have been attributed to it, whether there's too many or too little that have been attributed to it. People dying from other reasons. But it's assuming that's in the ballpark, we're somewhere in that 3 to 4% range of confirmed cases. But if it's 10 times higher number of cases, then it could be 0.3%.
Right.
If it's 100 times higher, it could be 0.03%.
Right.
But
right.
I think it's evident based on what we're seeing on the ground in the epicenters that it has to be more deadly than the flu.
Yeah.
It just seems like I think it would be crazy to say this is just another flu. It's not anywhere near as bad as the flu. 40,000-50,000 people a year die from the flu. I think that would be a silly conclusion to come to, just because of what we're seeing in these epicenters. It's got to be worse.
Yeah, unless in the endemic studies, like in New York, like if 50% of the people in New York have been infected by it,
right?
Then what we're seeing right now would make sense,
right?
And the fatality rate would be minuscule.
I mean, it could be. It could be.
Right.
I think to make that conclusion right now is premature.
Sure. Yeah.
And I think it's a fool's errand to make that conclusion.
Right.
Because of what we're seeing on the ground, of people in places that are seeing really big numbers of it. There's a lot of people that are getting sick enough to need to be in the hospital. We just don't see that whenever even the flu is,
right,
as bad as it can be during the year. We don't see this number of people having to go to the hospital. But there's also the fact that 30 to 40% of people are immune to the flu because they've been vaccinated. And we also have, the different strains of flu that people have already had before they come around each year. They try to guess which ones are going to cause the flu, and they vaccinate for those for 2 or 3, 4 strains of the flu. But there's some people that have already had that strain that comes about that year, so there's already some immunity there, and we still have 40 to 50,000 deaths or somewhere in that ballpark every year from it. This we have no immunity to whatsoever. So a lot of the deaths that we're seeing and people getting really sick is, due to the fact that there's no immunity at all to this virus. And
hence the novel.
Right.
When you hear novel, that's what that means. Yeah.
And I don't see this coming to an end. I don't see us returning back to normal life until we get to a point to where at least 60% of the population, or maybe even 70% of the population, is immune to it, whether that's through vaccination or through getting it and recovering from it. So again, that kind of shows you it would be very useful to know what percentage of the population has had it. Yeah. Because I don't think that we're there. I don't think that we're anywhere close to having herd immunity, but it would be nice to know if we had 20% of the people or 10% of the people, it would give us great information to make more projections and to know what we need to do from here.
Right. So, I mean, I don't know where the point is where, how long can we stay locked down from an economic standpoint without doing irrevocable and more harm than good. I mean, there's some point out there. And I don't think I think we certainly can't do it for 18 months. I mean, we cannot lock down the whole world economy for 18 months because the fallout from that would be orders of magnitude worse than letting the virus go freely and not even doing any kind of mitigation stuff. Yeah. But we want to protect the most vulnerable and we want to do reasonable things. And so, I mean, and again, I don't know where that line is, but I think even 6 months is untenable. To me, and hopefully we'll get some reprieve in the summer. Hopefully the summer will give us. I mean, have we seen is there anything new on that as far as the seasonality and stuff like that?
We think that it's going to be seasonal if it follows a similar pattern to other coronaviruses and other viral illnesses that are similar to this. They tend to follow seasonal patterns, and so probably the experts are saying that we'll probably get past this over the next couple of months, probably be down to almost no cases or very low level of cases by August, and then probably in the fall, in the late fall, start peaking or coming back up again. Now, will it be nearly as bad as this one? Who knows? I mean, that's another reason that we need to have more studies, and hopefully once we get past this peak and we start having more testing come online, we can actually know what we're fighting against a little bit better and get some of those population-based studies done to see what the incidence of this
Yeah. So
infection
hopefully by the
was.
fall we will have a much better idea
We'll
of what
more
we're dealing
information,
with.
be more prepared.
And then at that point, if we get the case down low enough, then we can have an effective containment strategy. Is that the goal there, I guess?
Well, yeah. I mean, if it starts peaking back up again, if we get down to very low numbers of people that have it, then we could have more effective containment strategies. Right now, it's so widespread that how do you contain?
Yeah.
It's all about mitigating and stopping it from spreading more. I mean, we still do contact tracing. They're still doing contact tracing, but it just makes it way, way more difficult whenever there's so many people that have it. And the fact that we don't know how many people are asymptomatic or have mild symptoms that are walking around with it right now.
Right. Okay. Because it's, there are a lot of economic factors on the economic side, as unemployment. I mean, we've seen, have you seen the chart that shows the unemployment?
Yeah.
I mean,
Over
just how
time.
it just dwarfs anything we've ever seen before. I mean, this is so unprecedented on so many levels. It's just unbelievable. And the amount of money, I mean, just the amount of money that Congress appropriated last week is mind-boggling. You can't fathom, how much $1 trillion is. Well, they did 2 of them, $2 trillion last week.
Yeah.
Not to mention the vanishing of 10 trillion plus in wealth from the world economy in a matter of a month and a half. I mean, it's just totally unprecedented on pretty much every level. And so, but as the unemployment rate goes up, the suicide rate goes up because people get depressed, and there's just and the third world. I mean, it really hurts the third world because you see a lot of kind of moral preening and pearl clutching about making this, you economic guy, you finance guy, all you care about is money and dollars and stuff like that. That's not the trade-off we're talking about. We're talking a trade-off of lives versus lives. Yeah. There's certainly a medical reality that if we don't take some steps, more people will die than would have otherwise if we didn't take those steps. The same is true on the economic side. If we don't get our economy back open to some degree and get back to some type of normalcy where the economy and the markets work, there's huge fallout to that as well, in suicides, in just in bringing people that are in the third world that are in poverty, bringing them out of poverty. I mean, think about people in the third world. I mean, that's huge.
Or people not being able to afford to take care of themselves, medically, or not being able to feed their families.
Right. How are we going to buy the tests if we can't produce anything, So it's, the economic engine, I think a lot of people discount the economic engine of society and the world, to the detriment of the very people that they're claiming they want to help. Yeah. And so it's not a dollars versus lives calculation. It's a lives versus lives calculation, and we just have to be, realistic about it, and not think that, we can just throw a bunch of money at this thing and stay locked down for 18 months to save, people's lives. Well, yeah, we might save some people, but it's going to cost us a whole lot more people on the other side of it. Yeah. And, I just think that's something that a lot of people don't think about. They don't think about both sides of the equation.
If the current projections, which are, again, they're much better than what we were seeing 2 or 3 weeks ago, if the current projections hold and, we do start seeing these peaks and they're at much lower levels than what they were initially projecting, I don't know that you're going to be able to get people to comply with, stay-at-home orders. I mean, if we see that this ends up being not nearly as bad as what the worst-case scenario projections were, then people are going to have to, government officials and people are going to have to ask themselves, is it worth continuing down this road? Yeah. I think for right now, these are just very recent changes over the last couple of days that have been made to these projections. I think if those hold, though, then we should really start looking at how can we start, letting people go back to work? How can we start opening the economy back up? Because we may actually be doing more harm than good. And
and not to mention the fact that crime, there's all kinds of societal costs to this that can come, So
everything.
It affects everything. Right. And it's not just it's not as simple as we want to protect grandma. Right. It's not just that simple. Yeah. Obviously we do. And I'm glad we do. That's a good, like we talked about in that first video. I'm glad we live in a society that cares about vulnerable people. That's great, But we just have to be careful not to, that the cure
There's
is
a
not worse
balance
than the
there.
disease.
We just have to find the balance. And
Right.
I think having more information will be very helpful in determining what that balance looks like. And hopefully we start getting these antibody tests done, these blood tests, or rapid, swab tests, and we can do more testing to figure out what we're actually dealing with, rather than working with extremely limited testing and extremely limited data, which is what we're doing right now.
Right. Yeah, sure. So, of the people with severe underlying risk factors, I mean, what percentage of the deaths do those people make up? I'm sure it's a huge percentage of it, right?
So,
older and,
people with high blood pressure, people with diabetes, people that are older. Those are the largest risk factors. There's actually been some data that people that are on immunosuppressive therapies have done surprisingly well. I've seen some reports of people that were on, transplant patients or, people that were on immunosuppressive medications, because what kills the people with this disease is, and this is from reports that we're getting from the field, from other physicians, is about a week or so after they come down with the illness, they have this immune system storm where you're just making all these inflammatory markers, and you have inflammation it comes from an overreaction of the immune system, and that's what ends up killing people and putting making their oxygen levels drop, making them get so sick and have to be on the ventilator.
So your body starts attacking itself, basically killing good cells and bad cells and everything.
It
just
overwhelming immune response. It's just an overreaction by your body to this.
So are they treating people with immunosuppressive drugs at that point? Is that one of the things
they
are
do? Treating people with medicines to suppress that cytokine storm, that immune system storm. Because it's basically that's the running theory now, is that's what's actually killing people. The people that have the more severe cases are the people that have this immune system cytokine storm that makes them so sick. And so there is some evidence. All the evidence we have is pretty weak right now at this point, but there's some evidence that people that are on immunosuppressive medications, or they're using immunosuppressive medications to treat some of the sickest patients with it.
That's interesting.
But the biggest risk factors, again, are age, and then the common comorbid conditions that we see, especially in first world countries like us, is high blood pressure, diabetes. Those people with high blood pressure are apparently one of the worst affected by this, but age is the biggest risk factor. It goes up huge. Once you get past 60, 70 years old, that's the people that are dying from it. The vast majority of them are in the older population.
So you could see, I guess, a scenario where we transition to let the young, healthy people go back to work and just lock down on the immunocompromised or the people with other underlying risk factors. You could just have a situation where everybody else goes back to work, kind of life is normal, but just lock those people away.
Or at least recommend that they stay in, and not at least not restrict everybody. I think that there's a balance to be found there. I think for right now, we need to probably continue with what we're doing. Just for now, and then I am really hoping that we will get some better tests in the next few weeks. We'll start getting more testing done, and we'll have more data from this initial curve. Hopefully this is the peak, or that we're getting close to the peak and things start going back down. And that'll be an indicator of how effective what we've done has been, and how severe this thing is going to be, and be an indicator that it wasn't going to be it wasn't nearly as severe as what we thought it was going to be. It wasn't nearly as bad, and so that will be a good way for us to judge what kind of balance we should have in the recommendations for people going forward.
Sure.
So that's coming in the next couple of weeks. We should have a lot better grip on what's happening.
Well, who do you think won in our debate?
I think we pretty well agree on a balanced approach to it. So I think that I won is what I'm going to say.
You would say that. You would say that. Well, I appreciate you coming, brother, and thanks for this conversation. I think it's going to be helpful to a lot of people. I've heard lots of good comments from our first video, and I appreciate your expertise and knowledge and willingness to talk. And hopefully with you got my book now, so you ought to be in good shape
CFO
on that.
Dad, hold on.
CFO Dad, you can get the model my book. Yeah.
Highly recommended, 5-star review.
Yeah.
By me at least.
Yeah, but they wouldn't let you review it though.
No, they wouldn't let me review it on Amazon. They have some algorithm that kept me from being able.
Yeah. All right. Well, I appreciate it.
All right, no problem.